Hello, today I'm going to talk about a very common condition. I see a lot of parents with a lot of anxiety going from various doctors, the pediatricians, general physicians, and even ENT doctors for a condition called adenoids and tonsils. Well, most of the parents seem to be anxious about what the treatment should be for this condition. Many of them are told for surgery and they're anxious about that too. Well, we all know these adenoids and tonsils are present in children. Usually they are present between the age of about 2 to 11 years, the adenoids are present, and maybe about 2 to 14 years is tonsils are present. Adenoids and tonsils are lymphoid tissue which are generally present in the normal children. In some children it may be much larger in size or may get repeatedly infected, causing problems. These are present in the body so that they can detect all foreign materials through the nose that you inhale and also food. The tonsils check them at that stage and you can produce immunity to these foreign materials. Well, yes, most of the things that we inhale or we swallow or we take through the mouth are usually done by the age of 4 to 5 years. And that's the time the adenoids and tonsils are maximum there and they're present in the body. Slowly after the age of 8 to 10 years, they slowly start reducing in size and go back to almost nothing. Well, in some children, there may be an increase in size of these structures which may produce symptoms. For example, the adenoids usually increase in size, causing blockage, whereas tonsils are those which cause repeated infections. When you talk about repeated infections, I would like to clear that a simple sore throat is not tonsillitis. Tonsillitis is an infection in which there is high fever, 101 to 102 degrees Fahrenheit, with painful swallowing, swelling of the neck or swelling of the glands. These are present during an acute phase of tonsillitis, which usually requires some course of antibiotic to be treated. So, repeated antibiotic courses of tonsillitis may be required. Whereas adenoids are those which are present behind the nose and they cause blockage. They may cause blockage symptoms like nasal blockage, difficulty in breathing, difficulty in sleeping, and also block the tubes to the ear, causing glue ear or difficulty in hearing. So, which children require this? Like I said, they are usually present in most of them. Who requires a treatment or a surgical treatment for that? Well, in adenoids, there are very simple, straightforward criteria. The absolute indication one would be if the child has failure to thrive. That is, the child is not growing up at all, not able to eat, not able to sleep properly, and not growing up well. Number two is severe obstructive sleep apnea. That is, the child is having difficulty in breathing at night, not able to sleep. And number three, which parents are not able to see, is presence of hearing loss because of fluid in the ear or called glue ear. Other indications like recurrent nose blockage or some amount of rhinitis or others are all relative indications. These three are the main indications why we would do an adenoidectomy. Whereas in tonsillectomy, as I said, it's a recurrent infection. So the criteria are very clear: 6 to 7 infections per year or 4 to 5 infections per year for the last 2 to 3 years. The reason why we are doing tonsillectomy when they have multiple infections is because the patient or the child requires multiple doses of antibiotics and also so many days are lost of school or work. Is it necessary to do tonsil and adenoid together? Well, there's no combo deal to it. Some children may require adenoid and tonsil to be removed. Some require only adenoid to be removed. Some will have only features of tonsillitis. So it depends on what the child has and who requires which treatment. So I would like to just bring forward to you these facts about adenoid and tonsils. I see a lot of patients, a lot of parents coming to me with features with an X-ray or features of adenoid and tonsils, and they have been told that they require surgery. Surgery requirements are only of specific conditions and specific indications. Most of the adenoids and tonsils after a particular age will go down, will reduce in size and go back to normal. Thank you.